getting the signal that we need to wrap up here. This has been a terrific discussion. I have a feeling we could probably go on for another couple hours, but what I want to do is give each of you an opportunity for some last closing thoughts, and I'll go kind of in the order that we have up on the screen here. Dr. Gabbay.
Well, you know, I think this has been a great discussion, and I do agree that we could talk for quite a long time more. I think key themes are, now that we know that diabetes prevention works, how do we get it to the most people? And I think digital solutions is a large part of that, being able to scale. I think, though, it's not for everybody, and having groups and the group dynamic that can be very effective, and having diabetes educators at the forefront of that, I think, is key. I really do believe that we're at this point where continuous glucose monitoring is going to be a lot more ubiquitous. It'll be an effective tool to be able to manage patients. There'll be patients that just that added information is enough for them, but then there'll be those that will need that as a tool along with other data that can be leveraged from their smartphones. And so I think technology is going to influence diabetes in a dramatic way in the next 2 or 3 years even. I think we'll see a big, big change.
Great.
Well, I'm going to make this really simple. I'm looking at the AAAs, just like AAA is in car safety, right? You can belong to AAA. Affordable, accessible, appropriate. Those are the 3 key words here, whether it's medication for people with diabetes, devices, CGM, insulin pump, apps, digital technology. It has to be affordable, easily accessible, and appropriate, meaning individualized for that patient. So even though we have a bio-identical drug and the formulary requires A, but A doesn't work necessarily for a particular patient. And that's where we get into the conundrum of affordability and population health. So affordable, accessible, appropriate, I think that's what the key is going to be for population health and better care of individual patients.
Way, I like it. Dr. Kaufman.
I think we're at a very exciting time. A paradigm shift, I think, is happening. You've got consumerism, where individuals are taking more control and responsibility for many things, including their health and healthcare. We've got technology being able to deliver something in the moment. You have it in your pocket at all times. We've got the concept of population health, the concept of value-based care, coming into a healthcare system that wasn't set up that way. So all of those things coming together, if the patient is at the center, if we always think of them as what's most important and their needs, that we as healthcare providers and payers and employers and health systems will make it so that we'll help patients to have those outcomes that they need. With all of that coming together, we're having the opportunity to make major changes at the population's health level as well as the personal health level.
Right. And somehow the payer has the last word here.
That may be appropriate. And with all of this going on, it really drives the fact that more than ever, we need adequate data to be able to make decisions on all these opportunities that are now available, of which ones are actually of benefit for patients and to improve the lives of our patients and for outcomes, and to be able to have that data available for physicians and other healthcare providers so that right decisions can be made.
Great. I want to thank you all for joining me in this discussion, and on behalf of our panel, we thank you for joining us for this AJMC Peer Exchange.